Okay, if folks can hear me, go ahead and give me an indication because I can't see anyone. Hello? Okay, all right. Thank you for letting me know that you hear me. My name is John Guidry. I'm here with Ken Pettigrew for NMAC. I'll ask Ken to introduce himself and the Escalate program, and then I can talk to you a little bit about it and some of our results, and then Ken can talk about some of the larger context. So Ken, do you want to get us started?
Sure. Thank you, John, and good afternoon. My name is Ken Pettigrew. I am the director for the Center for Ending the Epidemic at NMAC. I've been in this role for about 2 months now, but been part of this movement in terms of stigma, in terms of HIV advocacy for over 20 years. As you know, NMAC's tagline is Leads with Race. And for NMAC, that's very important. All the work that we do is through the lens of how do we see our work being operationalized through the lens of race. Where's the discrimination? Where's the gaps that we need to address through the lens of race? At the center, Ending the Epidemic, our role is to, what are the tools that we need to get us to the finish line, ending the epidemic? What tools, what programs, what services are important on a national scale, on a local scale, and working with partners across the country to ensure that we're able to make it to ending the epidemic. And we're sure as long as we keep having tools such as Escalade, which John is going to walk us through a lot of the components of, tools like this will definitely get us to ending the epidemic. So I'm going to turn it back over to John and walk us through the Escalate project from birth to where we are now.
Okay, thank you so much, Ken. As I said, my name is John Guidry. I'm partnered with NMAC through our company called TRX Development Solutions. We are the evaluator for the Escalate project, and NMAC is the lead agency. So let me just give you a sense of what Escalate is and what our presentation will involve today. So to begin with, I'll start off with some Escalate training goals and what the program is about. Then we'll talk a little bit about some preliminary results from the first 3 training cohorts, and then Ken can set us back a little bit more for some context, and then we should have some time for questions from the folks who are attending. So what is Escalate? Escalate is a 3-part project. We're only going to report on one part, which is training today. But Escalate is funded by the Ryan White HIV/AIDS program as a national program to reduce stigma that is experienced by people receiving HIV clinical services through agencies that are funded by the Ryan White program. That includes agencies in parts A, B, C, and D, the ones that are directly funded to do clinical work with people, as well as the ones who are subrecipients from Ryan White funding through the state or their municipality. And Escalate is a project of the national program. Escalate actually is an acronym, means ending stigma through collaboration and lifting all to empowerment. And it's a training and capacity building project that has three arms to it. One is training. So several times a year, up to 9 times or 11 times, depending on the year, we're gonna have cohorts of anywhere from 15 to 30 people who are receiving training on stigma reduction, and we're gonna talk about that today. A smaller group are going to go into directed technical assistance, or TA, which will be assisted by APT Associates, who is our partner providing TA through Escalate with NMAC. And a smaller number will go into learning collaborative participation, which is organized through NORC, which is the Learning Collaborative Participant for Escalate. And the learning collaboratives are going to undertake a couple of specific targeted projects around testing stigma reduction tools. Today, we're just going to talk about some results from the first round of training, in which we had 3 cohorts go through training during the fall of 2021. That's our list of associates, right? Now, in training, as I said, we've got about 15 to 30 people. I think we're about 17, 18 persons per group this time. They meet for 5 days, 6 hours a day. So it's a week-long training, Monday to Friday, which goes into topics about HIV stigma, but also other related stigmas that are involved in social determinants of health and other outcomes on the HIV continuum of care. And that includes racism, that includes homophobia, transphobia, ageism, other aspects of discrimination and stigma that affect people who are most heavily impacted by HIV. The training goals are to learn about the impact of these stigmas, to learn skills to engage in difficult dialogues to address them, to understand how implicit bias is involved in how people who are funded by Ryan White are delivering Ryan White services. To help people get some skills in critical self-reflection, and then to think about strategies that can get them from self-reflection to actually acting in the world in which they are operating. The trainees, who are all people who work in Ryan White provider agencies, so this is mostly staff, as well as some community members. I'll say more in a minute on that. But they can learn how to use organizational assessments to understand their organization's ability and need for change. They will understand how privilege works and how they carry it, and whether or not they need to check or understand or reflect on it. Groups who participate in Escalate come from agencies, and they will go back home with an action plan. And then we also are addressing self-care as people are engaged in this process as providers. Escalate, as I said, gets folks in it from parts A, B, C, and D, including all these various types of agencies that you can see on the slide. And organization in Escalate training is organized around stigma reduction teams. So a group of at least 2 people from an agency providing Ryan White services. One of them must have HIV and the other one doesn't necessarily need to. And this combines community members with staff members. And the pedagogy here is built around having people with the lived experiences that we're trying to understand and address in the room at the same time. That includes the lived experience of having HIV, but also the experience of being the service provider, whether that person has HIV or not, within the Ryan White organizations. And the pedagogy develops the mutual capacity of these folks to understand each other and help each other to reduce stigma. So as I said, we offered 3 different cohorts in the fall, the first 3 in this program, which has gone on for 3 more years through 2024. And in these cohorts, we had 39 people altogether come into Escalate training. And I'm going to provide for you some of the results from the training and reflect on them with you to give you a sense of what happens in the training. Again, the trainees are mostly staff from Ryan White providers. At least 1 member of each stigma reduction team from each agency is someone living with HIV. So they're coming into Escalate from a position of perhaps dealing with stigma in their everyday life. And they help the whole team to understand that experience as trainers take them through 5 days of reflecting and building strategies to address stigma. As I mentioned, we had 39 participants, and this slide provides a breakdown by age. About almost 2/3, 58%, were between 30 and 49 years of age. The vast majority college educated and higher. So we're talking about people who are at management, kind of middle management levels. Think of people who direct a program or who are an assistant manager in a program, coordinators in programs, and in some cases, higher levels of staff. And we open Escalate up to the whole variety of staff from top to bottom, including those who are not client-facing, because stigma reduction is a whole agency effort. And you need to have everybody on board with understanding what it is and how we want to address it. A majority slightly were cisgender female, and a slight majority were heterosexual, with 8 or 9% coming from other experiences of orientation and gender identity. 16% were HIV positive, so we did accomplish the goal of bringing a number of people into the process who have that experience. 35% Hispanic or Latino or Latinx, 24% Black or African American, 24% multiracial, 42% white, 5% Native American or Native Alaskan. So those are the demographics of the folks who've been participating in Escalate. Now what I'm going to show you are a series of slides about the training itself. And I need to set this up for you. In the evaluation, we survey the participants on a number of things. And the ones I want to share with you are called our knowledge, skills, and behavior assessments. We take these as a retrospective pre and post self-assessment in which we ask people the question on knowledge items that you have right in front of you, okay? And we have 12 knowledge items, 12 things that we know the training curriculum really wanted to help people to understand. And it's not a quiz. Rather, what we do after the training is ask people to think about their individual level of knowledge before the training on an item and how they feel about it after the training. So their self-assessing change from having very low knowledge to somewhat low, somewhat high, or very high on a 4-point scale. This is an effective way of understanding how people experience the program. And what you're looking at is the average change across all the 39 people who are participating. Okay. I think we had 42 participants as a whole, and about 39 opted to take the surveys. And in individual instances, we have more and less people answering specific questions. Now, what you see on the graph are the knowledge items. We asked people, how did you think your knowledge was before and after the training on different types of HIV stigma that occur in healthcare facilities? Just because you're funded by Ryan White to do HIV services doesn't mean the agency doesn't stigmatize in one way or another. So we were training people to understand. Understanding the difference between overt and covert racism. These are all of the items that are along the horizontal bottom of the graph. Learning about how some people define culture differently than I do. Understanding what the outcomes of cultural humility are. Understanding roadblocks to having more supportive interactions between clients and providers. Understanding simply what privilege is. And the change that you see on the blue bar, prior to training, people had a kind of middling understanding or a sense of their understanding. The average at 2.5 is that, a few more people were saying that they had a somewhat high, maybe level of knowledge than were saying somewhat low, right in the middle. As we see afterwards, the levels go up to about 3.5 and higher, which is where the majority are saying, I have somewhat high or very high understanding of this after the training. Okay. And I can tell you another thing that you can't see here, which is that before the training, the distribution from very low to very high was a lot more widely spread. And after training, people having a feeling that they had a somewhat higher, very high understanding was much higher. So what you saw with the training is people believing that they understand this differently. It's not the same as a quiz, and we were not going to quiz people. That's just not how you get good evaluation results. So the next slide is a second set of knowledge measures. Again, you see a similar kind of change, right? Knowledge about overlapping systems of oppression and intersectionality. A sense of understanding the difference between being an ally and an active bystander. Understanding privilege, entitlement, and defense modes of action. Understanding something that we call rolling with resistance as a technique. Understanding how organizations have different levels of readiness. They're not all in the same place. Understanding the difference between my own opinion of my organization and its actual capacity. Again, a lot of positive change. And in part, we're measuring some enthusiasm here. But we are definitely measuring the perception that people understand these items differently after the training. A second set of measures that we look at are skills measures, where we ask people again to self-assess about their skill levels. And we chose about 12 or 13 skills to ask people to rate themselves on. And I'll just pause for a second and let you look at them rather than reading them all, just to save time a little bit. While we notice that a similar pattern is happening. People are entering on average Escalate with a lower sense of their skills to maybe do things like identify practices that are stigmatizing, or use strategies, or understand using cultural humility. And these items and the way they're worded call on people to reflect. You kind of have to understand the item to be able to answer the question and rate yourself on it. And so when we see these kinds of patterns, we are recognizing something that's fairly systematic across the people in training. The second set of skill measures are here. Again, before and after. Same pattern. And I'll give you a second to look at some of those skills: engaging in difficult dialogues, thinking about my own biases, actively seeking out what my provider or my client expects, discussing my agency's policies, right? And then the third area is we looked at confidence to act, and we took the same items that were measured on people's sense of their knowledge of the skill of it, right? And then we asked people, okay, on those same things, how comfortable or how much confidence do you have doing these things? And there's a similar level of change before and after. And these, again, are the same skills that we ask people to think about, but now we're asking them to take a different stance toward it. Do you think you're going to do this? Do you feel confident in doing this? And there's the second set of behavior measures. And looking at sort of positive changes over time. And what we have there, not the Q&A yet, what we have here is an understanding of people's sense of learning, their sense of achievement. There's more data that we could do, but this is a short presentation, so I wanted to concentrate on these. But the program generates a huge amount of enthusiasm and a great sense of achievement, and people are learning these terms because they can't get through the exercises at the end of the training without having picked up a certain level of skill. In the training, we have an entire organizational assessment we provide. People took that, that's a whole different set of slides and another 20-minute presentation. But people are able to begin engaging and utilizing these concepts. And so it's thrilling to look at these kind of results. And we have opened up Escalate for the next set of cohorts that are starting up right now in year 2. And we're really hoping to meet more and more people who want to get involved in the process. I want to throw this back to Ken for some context on Ryan White or other experiences he's had, and then allow for some questions, and hope I've remained within our time frame. But thank you. Ken?
Thank you. Excuse me. Thank you, John. I think, I've been doing this work for probably close to 15, 20 years. One of the things that we've always grappled with is how to sort of identify stigma and then do things to sort of combat it. And when we think about stigma from a Ryan White perspective, like how many folks don't come into places and offices because of stigma? And then how do you identify it? And then what are the tools that you have? So I think it's really important when we think about ending the epidemic and we think about Ryan White services, where is that happening that keeps folks from getting services? And when they don't get services and they're not in care, then we have to be concerned about whether or not persons are virally suppressed, whether they're having healthy experiences. And so it is really important that we're able to address it. And being in the community for years, it's really tough to sort of look at practices that will help you in terms of identifying and tackling stigma. And so that's the work that we're doing at INMAC and spaces with Escalate, is how do you take tools. And if you was listening to John, they're actually tools that help people become more competent and able to address, first of all, be able to talk about stigma, then also what are the tools that folks need to address stigma. And I think this is really critical. And what's really critical about Escalade is it involves all the layers that are involved. It involves the community, it involves the clinic, it involves the service provider. That's really important that we're addressing stigma on all these different levels. So again, as we think about our Ryan White services and reducing stigma so that more folks feel comfortable coming in. And sometimes we just don't know what that stigma looks like. But this is the game changer. And this is a way that we can identify stigma, but also there are some tools that are available at the end of the training that will help people in terms of reducing stigma and providing that level of access for more folks who should and need and want to be in care. I'm going to leave it there and stop there for any questions persons might have. Don't hear for those questions. I also want to make sure people know how to get in touch with us. It's on the screen. Here's our email information, our website as well. Please feel free to reach out to us via these different mechanisms if you have questions and any other further comments or even would like to participate.
There's one comment or question rather in the chat that we can address. The person's asking, are people who have stigma, are they just unkind people? And I think that's a great question because we might think that, but one of the complexities about stigma is that it's not really that people are unkind. Some people are, that's true. However, many people carry stigmatizing actions and behaviors without being aware of it. Especially people who come into it from a place of privilege. You have people in Ryan White agencies who are trained as doctors and clinicians who have a very different background and set of lived experience from the people they're serving, who are people with HIV. They're in the Ryan White system, sometimes because they don't have the same kinds of advantages that other people living with HIV who have really good medical insurance have, for example. And this inflects with race and with transphobia and homophobia, where clinicians in the process have never, unfortunately, but this is the nature of our society, have never been asked to even think about their privilege. So part of what Escalate's doing is trying to unravel all of these layers that the people who provide services kind of walk in with to help folks to really identify, oh yeah, the people I'm serving have a different set of experiences and I need to recognize that. I need to have approach it from the standpoint of what we call cultural humility, which is to say, I need to listen to what my clients are saying about their lives before I try to solve, quote unquote, solve their problems, right? To understand what the person living with HIV brings into the room. So this is a process of helping people understand that stigma is something that people carry with them and that they can change. And indeed, as one person knows, stigma does make someone unkind when they enact it. And the process we are involved in Escalate is helping people identify ways to not do that, and then ways to identify it, to call it in and address it in real time.
I will also add to that it is sometimes as simple as what John is saying, you don't know what you don't know. And you could be very well participating in practices that are organizations that are clinic and service providers, and you may simply not know or aware of the things that we do sort of prevent folks from coming and accessing our services. So I think it's important. And I also think that sometimes we think because we're in the work, we couldn't possibly be the ones who are doing the stigmatizing folks, but you just don't know. And I think programs such as Escalate give people an opportunity not to shame people or point fingers, but how do you identify it? And then what are the tools related to that? And I don't see any other questions.
Nope.
John, any last thoughts from you?
No, not for me. I think we're good. The program's open. You guys can go. I'll put something in the chat here. The website that you could go to is called Target HIV. That is the Ryan White kind of web page for all of the work that Ryan White does. If you Google Target HIV, your first answer will take you right there. And on the Target HIV website, in fact, if you were to Google Target HIV Escalade, it would take you straight to the Escalade page in Target. And that you would be able to see opportunities to participate in Escalate if you are working in, or if you are a client of one of the agencies that are funded by Ryan White, because some of the people who participate in Escalate